I had to keep her alive for 13 hours until the RFDS could get there. Then, of course, you sit down with the family and say, listen, I'm terribly sorry to say, despite our best efforts, your loved one has passed away. Although I can prescribe that quite legally for medical reasons. Still, you're a criminal for driving with THC.
You could overuse anything though, could you not?
Anything. Even politics.
Today I was just wondering, this morning while I was driving into work in kind of peak hourish traffic,
Sure.
I was just wondering, what was your first car that you ever bought?
My first car.
Yeah, first.
It was a Hillman Super Minx, ESC 555C, I remember it well. It's an ancient car, second-hand of course, very much second-hand. It was a gorgeous pre-industrial car, loved it.
What do you mean by pre-industrial?
It was 1960s technology. It was good.
Things were a little bit simpler back then. A little bit like, you know, this bill you're trying to pass through Parliament at the moment. Can you tell us a bit about that? Because I'm really curious.
But it's had several bills. Which bill are you talking about?
The THC driving bill.
Oh, that's a bill we're preparing. We've got actually tomorrow, we've got a motion coming up. Mm-hmm. You see, we've been working on this for 2.5 years. What we have just now is actually a lie in law. The law says that if you have THC in your system, that's the active ingredient that makes you a little bit high in cannabis, if you've got THC in your system, you are by definition impaired. Okay? That's wrong. It's scientifically completely wrong. And they've also said this is an illicit drug. It's been prescribed illicit in the legal language of the law. So if you're driving with THC, you've got an illicit drug in your system, although I can prescribe that quite legally for medical reasons. Still, you're a criminal for driving with THC. That is in our law. So two lies. First of all, it impairs you in any measurable amount. And secondly, that it's illicit. We have this in law right now. And so we've been working for 2 years to get the government to see this is a wrong law. So many people have suffered. Yesterday I had a patient who has major anxiety problems, can't take the very effective THC, the much safest drug, because they could get stopped by the police, they could get tested, and then they would be a criminal. Then they wouldn't be able to travel to America because they're now a drug user. You see? So what are they going to take? They're going to take benzodiazepines or other drugs which are heavily influencing their impairment. And that's okay. I mean, for goodness sakes, we're actually causing real physical and mental damage because the law says we should.
So, as a layperson, you know, not as you know, I'm a behaviorist, so I deal a lot with how people operate.
Sure.
As a doctor, what would be the difference, just for our audience, between say alcohol and THC? Would you say what would be the actual difference between the two? Because people drive with a 0.05, is that right?
People drive with 0.05, but we have actually a law which enshrines you're able to drive while impaired. You drive with 0.048, are you impaired? Well, actually 0.05 is when you get double the number of accidents, so for sure you're impaired. And we allow that to happen. Okay? Alcohol last year, 6,500 people died because of alcohol in Australia. Because of cannabis, 0 died. Which of the two is the dangerous drug, I ask you? Oh, there we are. Now, then again, we can often use alcohol medicinally because I'm nervous. Okay, so you take to calm the nerves. It's a central nervous system depressant. It removes your ability to think clearly. That's why you drive faster, you drive certainly unsafely. Cannabis is very, very different. It's much healthier for you. Yes, you can overuse it. Absolutely, you can. But used medicinally, it's probably the safest drug in my pharmacopoeia.
You could overuse anything though, could you not?
Anything. Even politics.
Well, that reminds me about your political dog. Tell us about your political dog.
I have a little beautiful 3/4 Maltese, 1/4 Chihuahua, Charlie. He's absolutely gorgeous. Cool. Small dog. And of course, you've got to take your dog for a walk every day, twice, and he'll do a poo, certainly lots of pee. So I'm walking my dog on a regular basis. I was elected into politics, and up until then, my dog once, maybe twice would poo. So now I'm a politician. I'm now walking my little dog. And he stops off for his usual poo. Clean it up, as you do. And a short while later, he poos again. Not very commonly, but he pooed again. Okay, pick it up. I'm walking with my wife. A little while we move on, He poos a third time. He's never done this before. He's pooed for a third time. My wife says, what's going on? I say, it's okay. He's a political dog now. He's just full of shit.
Well, hopefully you're not like that, and I know you're not like that because you're telling us the truth.
But everyone who who knows I'm a politician, they think I'm full of shit. It's what you think. It's what you think, isn't it?
I mean, I must admit, politicians do have a kind of reputation, but is it justified? I don't know. So what I'm and getting to know a politician, getting to know you as a person, not just as a GP or a politician, I think it's really important for our audience. In fact, for everyone, because it's that connection to that person. It's that bond that we're really looking for. And I wouldn't vote for someone I don't really know. I mean, I've got to
should you.
really understand them, really know them. So what I'm wondering about, so for our audience again, what have you been up to this week in the medical practice? What's been happening?
Oh, in the medical practice,
that you can tell us about.
I specialise. I'm specialised in looking at thyroid and other hormones.
Yeah.
I specialise, of course, in prescribing cannabis, dealing with cancers. A lot of my practice is also mental health. Okay. So I supervise doctors who are doing the usual general practice. But yesterday, for example, a man came in with acute chest pain. So I used to work as a cardiologist, and so you fine, deal with that. So I still do the general medical stuff, but most of it's more specialized, more niche medicine, which is, I'm also very much seen as a kind of an alternative thinking doctor. So that's what I do on a regular basis. And I'm very well thought of, if I do say so myself, but I'm always on the, how can I put this? My specialist colleagues would really hate me because I do what they think is quite wrong. It's not what you learn in medical school. But hey, my patients are getting better and I really couldn't care less. As long as they get better, that's all that matters. There's a lovely aphorism in medicine. It doesn't really matter what you're doing as long as you get better. Okay? The most important thing is you get better.
Well, one of the ones I've heard is, the operation was a success, but the patient still died.
Yes.
So, I absolutely get it. And, you've had this long career as a rural GP. Can you tell us a little bit more about, some of those unusual things that you've done out there that people might not really know about?
The unusual things?
Yeah, the ones that really would pique our interest.
Well, for me it's usual. So when I say what I'm doing, people find that unusual. I think it's quite normal. For example, working remote and rural in Australia. Okay, for us who've done that, it's normal. But for the doctors who work here, how can you do that? I was working up in Fitzroy Crossing, sitting having a coffee with my colleagues up there. Now, in that place, you're remote, you're rural. I had a patient there. She came in. I won't tell all the details, but she had basically cardiac failure due to a valve which was malfunctioning. She should have had operation a long time ago, but she'd always deferred. And then she was brought in extremis, actually, with a chest infection, a bit of pneumonia, and also in congestive cardiac failure. So now I, as a simple GP, ordinary, unspecialised GP, well, I'm a specialist GP, of course, but there I am in Fitzroy Crossing with a patient who is going to die very soon. I was unable to get a central line in because there was no ultrasound, and I used to put them into people's hearts as a cardiologist, but I wasn't going to go anywhere near her neck with a big needle because I could do some really bad things with that. So I couldn't get her central line in through the jugular vein. Right, the peripheral veins were collapsed because she had no blood pressure. So I put in an arterial line into a radial artery. That way I could measure her blood pressure and I could also get some fluids into her. I had to keep her alive, measuring her heart failure and her chest infection with very different treatments. I had to keep her alive for 13 hours until the RFDS could get there.
Oh, wow.
Now, for us working in that kind of environment, that's normal. For your GP working in Perth, they say, wow, couldn't do that. Yes, you could. Yes, you could. But we do that because we're comfortable being in an uncomfortable place.
That's it. And resilience is about, leaning into the pain, leaning into the uncomfortability. So what's the most uncomfortable you've kind of been in a situation like that? Besides the time that someone held a knife to you?
Well, I started out in medicine, in my medical studies, wanting to be a pediatrician because I love children, still do. And I realized very early on, working in the children's ward as a student, I cannot see children suffer. I will not see children suffer. It breaks my heart. To take a dead child into the morgue, every time my heart, it's heartbreaking. So I realized I can't do this. So when I'm in that remote and rural area and they bring in an infant, say 2 months old, needing to be resuscitated, that absolutely scares the pants off me. I hate it. I do it, but I hate it because I'm so not in a comfort zone.
Yeah. And I mean, a lot of people would be worried, that if they make a mistake or, that they're going to feel guilty or something really bad's going to happen. I mean, how did you manage that? How did you deal with those feelings?
Well, if you do break, you're more liable to get mental health problems or suicide. That is true. And we all, as doctors, we all make mistakes. Of course we do. And bad things happen. Absolutely they do. The trick is to realize that we're not God. Okay, that's an old medical joke. What's the difference between God and a doctor? God knows he's not a doctor.
Yep.
Yep. So you've got to realize that you are not God, and you can't control everything. And I remember one time, I was working in ICU, and this young man was brought in. He tried to commit suicide. He'd taken a concoction of drugs. I've forgotten if there's alcohol involved, but it often is. Anyhow, concoction of drugs. The trouble was that the drugs there worked together such that we couldn't reverse that. The effect on the body was just impossible. So he deteriorated more and more and more and passed away. It took 2 days, I think. And nothing I could do would save that person. And wow, you feel really bad. And then, of course, you sit down with the family and say, listen, I'm terribly sorry to say, despite our best efforts, your loved one has passed away. After all the trauma of having failed to rescue a patient, you've now got to tell that news to the family. So it's double the trauma.
And I'm just going to ask you a quick question, because this is actually from one of the audience members. One of the audience members is a school teacher, and she was really concerned about the teacher shortage. And she's saying that the education of our children is really suffering because there's just not enough teachers to basically look after basic things. What's your thoughts about that? Talking of children, because it really just reminds me of what I was asked a couple of days ago.
Well, I have to say, my youngest has just finished school now. The final exams are happening in 2 weeks. And he has had, both my children have had a wonderful education in a private school. Now, I'm blessed I'm able to afford that. And the standard of teaching was excellent. On the other hand, I've been up, say, in communities, say, in the remote areas of Western Australia, where there has been very little and a very difficult population there. I remember this beautiful young Indigenous boy saying, yes, I'm top of my class in maths, but he was unable to do a simple multiplication. But he could teach me how to walk to that far hill across the desert and catch guana, because it was good eating there. That boy would survive. I would die.
That's true, yes.
So what are we teaching our children? So are we teaching them appropriate things? Now, when it comes to schooling, we're actually using a system which is designed from the 19th century to educate children just enough to be employable in someone's factory.
From the Industrial Revolution days? Yeah.
And we're still on that same system. Now, the teachers I've met are hard-working, really dedicated, passionate people who really care what they're doing. I think that's across the board. But how much are they getting paid? A pittance. How much are they being given support in the community? They're not. They're being shafted by parents who say, you must now educate my children in morals. I'm not going to do it. You're the teacher. So there we are. That's another topic for a discussion. We could maybe spend some hours talking about that. Do you think?
Absolutely. Well, thanks very much, Brian. It's been absolutely wonderful out here in the sunshine. If you've got any questions for Brian, please feel free to contact him on the website. And have a lovely day, mate.
And you, my friend.
See you, my friend. Bye-bye.